Welcome to Body in Balance Podcast. I am your host, Charlotte Johnson, the certified licensed physician assistant, sent here to kick some knowledge your way once a week for the purpose of educating, informing, and enlightening this audience concerning physical, spiritual, and emotional aspects of our bodies in relation to our Creator, the one, the only, the true and living God. He is the King of Kings and the Lord of Lords. Let us give it up for Yahweh. Hey, I am so excited today on Body in Balance. Now, I want you to know I am a otolaryngology PA. I work in ear, nose, and throat as a PA. However, the first 12 years of my career, I was in internal medicine. So I did a little bit of everything. I also worked in urgent care. Working in urgent care, I have seen some tremendous different outlooks on different diseases, infections, different processes that take place on people. And one of the sort of fascinating, grotesque, rather almost disgusting diseases is something called necrotizing fasciitis. Necrotizing fasciitis, or flesh-eating bacteria. In a ear, something that's analogous to it that can make do a lot of tremendous damage is something called malignant otitis. It's not from cancer, but it's from infection that will just eat away at tissue, soft tissue, cartilage, skin, bone, whatever it is in the way. These bacteria just destroy the tissue. Now, I am going to give a disclaimer. What I did not do, I just could not find the pictures of how necrotizing fasciitis destroys tissue is just, I would say, a little bit too disgusting for the normal eye to look at. And I thank God for all of my followers on TikTok. My TikTok is growing. I've been on there 2 months, and now, 2 months, and I have gotten over 1,000 viewers. I have now on my YouTube channel, I just want to thank God and give a shout out to all of you all who are watching on YouTube. There are now 6,000, a little over 6,000 subscribers to my channel. So we are going to jump in. So why did I decide to pick a rare flesh-eating bacteria, necrotizing fasciitis, disgusting topic? Well, I did because a good friend of mine who is well known throughout the church, a pastor friend of mine, came down with this disorder. And I'm going to pop his picture up here. This is Pastor Daemon Stevenson. Pastor Daemon Stevenson, who is a good friend of mine within the Church of God in Christ, and we work together on a committee with our General Assembly or the governance of the church. And so it was a few months ago last year, that he suffered from this particular infection, and he almost died. He almost died, and he ended up writing a book, and the book is called The Flip: Life or Death, the 50-50 Journey. He almost lost his life because of this infection. So because of that, and because of how closely we've worked over the years, I felt like it was important for me to share detailed information about this particular rare disorder or infection and how you can obtain it, how it can happen to you. It can happen to anybody. But we thank God for Pastor Stephen's life. We thank God for how he was able to flip the script. And that's because of his faith in God. And it wasn't really him that flipped the script. Oh, but it was God. And so I want to talk about this disorder, understanding necrotizing fasciitis, its causes, its symptoms, treatment. Really, what is this? What is it? So let's talk about its prevalence, the prevalence of this disease. Now, I have a caricature of how this disorder infects the skin, the soft tissue, the muscle. It can get to the muscle. So I put a caricature up because I just didn't think that many of you would be able to stomach it. I've had to help debride wounds like this, help fight the infections on teams to save people's lives. But it's not something that novice can, and people that are not in the medical field can actually grapple with. It's pretty rough. So I just showed you a caricature of a leg. This is a lower leg, the back of a lower leg, and then you see the skin. We're going to get into it, the layers of skin and what it does. So let's talk about a definition and classify it. Necrotizing fasciitis, the overview, we're talking about a very, very serious infection causing rapid cell death to the tissue of limbs and body parts and the surrounding tissue. How does it present? It can present differently in different people, and there's different clinical presentations depending on one of the prevalent 3 bacteria that you may see in the patient that we would be working with, or if it were yourself, on yourself. So different clinical presentations help identify the type that it is. That's not something that you would worry about. That would be something that myself and my team would worry about, that is working with someone that has this problem. Most likely, there are surgeons on the team. The epidemiology and the prevalence. So what's the prevalence that you see with this disease? One, it's rare, but it's severe. It's not common, but it can happen. So those of you that love to go to lakes and ponds, that's standing water. Standing water is very common for having things like this. But those particular bacteria. So you can go jumping in the lakes, you can go jumping in ponds, and you can jump into these things. However, I would not suggest that you ladies shave your legs before you go do something like that. Because if you cut the skin or open the skin up a little bit, and there is some kind of weird bacteria that's growing in that hot summer water, then yes, you can have something enter into your body. So lakes, ponds, standing water, those are places that these particular bacteria can thrive in. Geographically, places that there's higher frequencies of stuff in humid conditions, very humid conditions. Social factors such as people that are unable to they don't have places to live, so they don't have water, so they can't clean their skin as much, and their skin opens up and breaks. Those are some factors that can happen. Those that have immune deficiencies, not just HIV, but diabetics, the elderly, those that live in nursing homes, skilled units, not just skilled units in a hospital, but I'm talking about nursing homes. They can have it because they lay down so much. You can get bed sores. That's something that can cause, that is a problem. Influencing factors are those things that I just talked about. Those people that have comorbidities like diabetes, HIV, other immune deficiencies, elderly, living in close quarters, those people that don't have access to insurance. And so something that was really small gets worse, is not treated. The infection gets worse and spreads and begins to start damaging things, especially if you get the type of bacteria that causes this. And we're going to talk about that. What bacteria usually causes it? Usually it's group A strep. That's the primary one. So streptococcus can cause it. There's polymicrobial infection. So there's a multiplicity of bacteria that can grow. When I'm talking about pond water and lake water, most likely it's a polymicrobial infection, something that's been able to sit in that water and grow because it's nice, warm, and dark under the surface. If you jump in there and you stand on a rock or step on a rock and it cuts open your foot, it can easily happen. You can scrape your leg against something in the water and open up a sore, and that can happen. Staph aureus. Many of you have heard of MRSA, the resistant Staph aureus. That is something a lot of times you can get that when you're wrestling on mats. That's why they clean those mats for wrestlers very well, so that if there is any kind of opening on the skin, you want to make sure that that doesn't happen. So these are your causes. These are your causes. It's bacterial organisms. I have put out several slides, and you can see them on Body Imbalance 25. We talked about bacterial organisms when we did the hand washing. When we did the hand washing, I told you there was 3 groups of things that can cause infection: bacteria, viruses, and fungi. Again, bacteria, viruses, and fungi. All of these will do reside on the skin. They reside on the skin. And so at any given time, your skin is like a big uh saran wrap that's around the rest of the body. So if you took a hunk of meat and you wrapped it in saran wrap, or you put it in a Ziploc bag, your skin is a Ziploc bag to your organs and what's beneath it. That keeps everything else out. So if you get those people that have psoriasis, those people that have eczema, it dries out the skin. If the skin dries out, it makes it itch. If it itches a lot and you scratch and you scratch and you scratch, then you can break that barrier. You open that Ziploc bag, and then all these little organisms that you see here can just run right in and make a humble abode in your body. You become a host to these things. So, skin, this kind of reminds me, this is a block of skin that you can see the different organisms. I don't know, it just, in my mind, it just reminds me of lasagna. You know how lasagna stacks up. I know some of you people may not understand that, but it just reminds me of like a hunk of a square of lasagna. So let's go to the bottom layer. The bottom layer is the muscle tissue. That's the muscle tissue. Then you have a thin layer, a thin flat layer of fascia. And that fascia covers the muscle and separates it from the fat. The fat tissue gives the body the oil that it needs, the oil that it needs to stay moist so that it doesn't dry out. Now, in that fatty layer, there's also the blood vessels that supply that skin tissue so that it doesn't die. And it goes up, and then you see these black things sticking out. Those are hair follicles. Well, the hair follicles have to have, there's another layer of fascia that is there. So the top layer is your epidermis. That's where the skin color is. So your the melanin cells are there on that top layer. Hair cells stick out. So that's where your hair comes out. And the hair follicle is deep in what's called the dermis, or the dermal layer. That's where blood vessels are, your hair follicles are. And then you see it's another superficial fascia layer that is just above where that fat tissue is. So that being said, once you scratch that epidermal layer enough and it gets down into the dermal layer where the blood vessels are, now those bacteria can get down in there, can get into the bloodstream and start just destroying the rest of those layers. And it can destroy, and it just eats away like Pac-Man down to the muscle tissue. Sometimes it gets so bad that, well, we'll talk about that. We'll go into that later. But the bacteria spreads quickly and extends into this tissue, damaging our skin. All right, let's move on to the next. So who are our high-risk populations? I basically talked to you about that. Who usually gets this? That is people with weakened immune systems. That is elderly, HIV, diabetics, and those that have cancers, those that are in that are elderly in facilities. So chronic illnesses, people that have chronic illnesses, and those that you may be young, but you had a serious type of surgery and you become vulnerable. That will increase your risk. So, what are some of the signs and the symptoms? Now, this is very important. If you haven't listened to anything I said today, you need to figure out the signs and the symptoms so you'll know, because this is not anything to play with. You can ask Brother Daemon. It was nothing to play with. He was facing being here or not. And so, early signs and clinical presentation. You can have severe pain, but the pain is disproportionate to the area that you're complaining about. When I talk about this concerning ears, and it's called malignant otitis, that's a type of the necrotizing, destroying fasciitis for the ear. So a person will come in and they just got severe ear pain, and it's really bad off, but that ear isn't getting any better. And so they just keep having this pain, and it's out of proportion to what the physical exam looks like. If they come in, I've had a patient that came in, on a Monday. I saw them Thursday, and from Monday to Thursday, they were complaining of some severe pain, but it just didn't look that bad. So they got some oral antibiotics, and the problem was they were elderly and they were diabetic. So I said, well, let me have him come back in on Thursday. If he gets 3 days of antibiotics, this ought to change. Well, it didn't. And the ear, the face, and everything, it got worse. There was redness. There was swelling of his face, swelling of his ear. He was running a low-grade fever. Now, elderly people don't run fevers as much. So if an elderly person has a fever, there's a real problem. And so it became urgent very quick, because he had to be hospitalized, because oral antibiotics were not going to take care of this. They just were not going to help. So what are some of the diagnostic tools that we use to figure out what's going on with the person? Well, you need to be on top of it, with it, and if you got a great provider, great PA that knows what they're doing, hint, hint, then they will start to do a very good clinical evaluation and assessment, get a great patient history. They will look at risk factors, all those things that I showed you at the beginning. If the risk factors are high, then you need to be coming in sooner. A lot of times there's a shortage in appointments, there's a shortage of providers, but there's some diseases you can't have somebody come back in 3 or 4 weeks. They could die from this. So you have to figure out a way to get them in. Like I did that person on Monday, and I saw them on Thursday. 2-3 days of medication, no change. It was time. It was time. So what do we do? How do we find this? We use MRIs, or we use CT scans, the high resolution CT scans, to look at the soft tissue. You have to be able to see the layers of tissue so that you can see, is this destroying quickly and deeply, and is it causing a change in what layer and how deep? Because now we've got to get surgeons involved, because they actually have to go in and do, like when you peel a potato, they've got to gouge out or pull out, like you take an eye of a potato. You got to take all of that dead tissue out quickly so that you can stop this from continuing. Lab tests are important. Getting blood cultures are very important, and taking inflammatory markers to see how deep it has gotten into that tissue, the skin tissue that I showed you on the last slide. Now, I want to share some tips with you all. Now, what tip do I want to share? Well, I'm glad you asked. Once we find out what's going on, or say, let's go back before we get to that part. There is a soap called Hiba Cleanse. Hiba Cleanse. This is so important. If you are a little on the overweight side, if you are a little plump, during the summertime, you want to have some of this Hiba Cleanse. Hiba Cleanse is used to prep people for surgeries. But in the summertime, at least twice a week under your breast, for women that have large breasts in the summertime, you should clean with Hiba Cleanse. In the buttocks region, around like your thighs, in deep skin folds, under your belly, all those areas, you should clean at least twice to 3 times a month with the Hiba Cleanse during the summertime, because it cuts down on skin bacteria that could cause, and it's a broad spectrum type of microbial fighter. So you want to do that for prevention of something like this. All you need to do is put a little on a face towel, rub it under the breast, rub it under the belly where there's folds, because if you notice, sometimes that skin is a little darker because you can get fungus under there in those areas where there's a lot of sweat. So if you are on the larger side, you want to do these kind of things so that it cuts down. Hiba Cleanse doesn't cost that much. It's like one bottle, the size that you see there is probably like $10 or $13. So you can use that. And since you're only using it once or twice a month, and you're going to do it in the summertime, then you would probably have that for a couple, 2-3 months. You don't need a lot of it. You just put some on there to make sure that you're using an antimicrobial soap. This is very important for those that are diabetics, for those that are overweight, for those that have a lower immune system, for those of you who are caregivers for seniors that sit a lot and lay a lot. You want to clean them at least once or twice a week with this soap. Okay. I just wanted to give you guys that tip, because Hiba Cleanse is out there, but it's usually used in hospitals for surgical scrubs. It's early aggressive, so they use that to remove or to clean tissue before they do surgeries. Now, after surgical removal of the tissue, what do they have to do? Rehab. So, rehabbing and supportive care entails making sure you're getting plenty of fluids, that you're drinking plenty of water, that pain control is taken care of, so that you will, if you have too much pain, then you don't want to move. If you don't want to move, then you don't use the limb that has suffered the injury, has the surgical wound, and has to be cared for. So rehab and therapy, physical therapy, is very, very important. Now, in conclusion, this is urgent. This is serious. My friend, brother Damon, almost lost his life. And what I'm going to do is get an opportunity. I've talked with him, and I'm going to get an opportunity to interview him and talk to him on the show about what went on, so you can understand. I just gave you the clinical, what to do, how to do, what it is, but I want you to hear from a person that's actually experienced this and had not had this opportunity, didn't have an opportunity to hear what you're hearing from me. That being the case, this could save somebody's life. I know the Lord is here to save your life, but there's some things that we can do, and you can't do any better than you know how. I'm going to give credit to Mother Fortson for that statement. She used to tell us, you can't do any better than you know how. So I'm giving you some know-how about this necrotizing fasciitis, flesh-eating bacteria. It's urgent. You need to recognize it. You need to see if there's severe pain and swelling and redness, or your skin starts getting dark if you're African American, if you're light-skinned African American and it starts turning red, if it's warm to touch or extremely painful, you need to go to not just an urgent care. I'd go to an emergency room, because urgent care, that's a treat 'em and street 'em place. And if it doesn't look that bad, they may not tell you to come back, or they may not tell you to follow up with your doctor. But please remember, if you didn't listen to anything I said, if it's not getting better and you've been on an antibiotic for 2 or 3 days, you need to go back. And you need to keep going back, like the woman in Luke chapter 16 that kept going to the king until he finally listened to her. Until, I don't care if you have to weary that doctor, you keep going back, or worry that provider. Keep going back until they do something, because this can take you out of here. Causes, get an understanding. The causes are bacterial infection. Early symptoms and the timely diagnosis is important. Effective management is something very important. And I'm going to get an opportunity to have you all get a chance to hear from Pastor Daemon Stevens, whose life God spared. God literally spared this man's life. Now, he has a book. You can get it on Amazon. If you see him at the convocation, he will have it at the convocation, which is going to be in November. But the book is called The Flip: Life, Death, the 50-50 Journey. I want you to take the opportunity to support my dear friend by going on Amazon, and I'm going to set up a link on my YouTube channel and through my TikTok, and you should be able to get it there also, because I want to make sure that he gets blessed for sharing and letting it be known what happened to him, so that it doesn't happen to you. Public education on wound care is what I wanted to do today. That HIBA cleanse, HIBLICCNE, or no E, HIBA cleanse, CLENS. I want you to make sure that you get that HIBA cleanse. If you are overweight, if you are diabetic, if you sweat a lot, if you work out at gyms a lot, make sure that you use that soap. It will help to prevent the loss of limbs or life. survey and watch over your skin. We're going to be talking very soon to Pastor Daemon Stevenson, but I want you to make sure that you go to Amazon and look up his book, The Flip. And I look forward to seeing you probably in the next few days where we will interview him. I'll put something out so you'll know about it. But make sure that you go over my slides today and that you pick something up, because this could be life-saving to someone on this channel. God bless you. You all take care, and hopefully you glean something that will be a blessing to you or somebody in your family. Hopefully your horizons have been enlightening.